Hello everyone. So my normal camera holder isn't here. So I'm going to try to do this one-handed. Should be okay. These are two examples of hearts you might see. This one has been cut in a weird way so we can see a special valve, but I'll get to this one more in a minute. Let's start with this one. Outside of the heart, we have the apex, our tip. All this material, this thin stuff covering the heart, is the inner layer of the pericardium. It's the epicardium. So you would say epicardium on this part. This groove down the front of the heart is the interventricular sulcus. This is actually where that ventricular septum lies. Look, they lie right on top of each other. So that septum causes a little groove to form here. Meaning all of this would be the left side of the heart. Remember, your left side of the heart is the bigger side. This side would be the right side. So this would be where you'd see the right ventricle. It's the open space inside. Okay, so all these blood vessels along here, we're going to call those coronary vessels because we can't exactly tell you if they're arteries or vein. So coronary vessels is fine. Now at the top of the heart, let's see if I can prop it up right. Well, that works. All right, at the top of the heart, we have the pulmonary trunk. And this big guy is the aorta. The first branch off the aorta, if you remember in the cats, is the brachiocephalic artery. So we have brachiocephalic artery and the aorta. Now on the front of the heart, we have these weird floppy things. Those are the auricles of the atriums. So this is the auricle of the left atrium. And over here, we have the auricle of the right atrium. How do I know left and right? Look for the bigger side. There's the septum, there's the bigger side. Now I know we're on the front because the pulmonary trunk is right there in the front. If we flip this over, you see all this mess. That is the backside. Now, still, even on the backside, you can see that this sulcus is still here, and meaning this side is bigger. That's still the left ventricle. So this is still the left side, right side. All right, other little holes we have here. Now, this small opening is going to feed into the right atrium. So anything going into the right atrium would be the vena cava. So this is, I can't tell you for certain if it's superior or inferior, but that would be your vena cava. My guess is my finger's in the superior, and this would have been the inferior, but we're not sure. So on the exam, I'm fine if you just say vena cava. All right, going into the left side. This would be coming back from the lungs into the heart. So this would be the pulmonary vein. Pulmonary vein goes into the left atrium. Open up the heart, you can see, there's my finger, left atrium. All right, now let's look inside. Inside we have 4 open spaces. It's kind of tough to see that on these hearts, but just be aware, anything above this valve, the bicuspid or tricuspid valves, everything above those valves is the atriums. So this would be the right atrium, left atrium. Below the valve is the ventricle. So this is the right ventricle, and this is the left ventricle. On the exam, I would probably tell you, what is this open space? What is this chamber? Might be what they ask. All right, so the valves themselves, we know that it's right to tri, so this is the tricuspid on the right side. Over here we have the bicuspid. Both the bicuspid and tricuspid are held down by the chorda tendineae, these heartstrings. And the chorda tendineae attach to these muscles, the papillary muscles. Now the smooth layer inside here is called the endocardium. Remember, we had epi on the outside, endo on the inside. All of this muscle is the myocardium. Now, this part of the myocardium is actually between the ventricles. So if I pin here and I ask you what structure is this, then clearly I'm not asking for the muscle. I'm asking for interventricular septum, the dividing line between the two ventricles. Interventricular. All right, now those are those two valves and some structures. Now we're going to look at the two valves going into the aorta and the pulmonary trunk. This is where it gets really important. You remember your blood flow through the heart. So we go from right atrium to right ventricle. From the right ventricle, we're going to go out through the pulmonary semilinear valve. Now this heart is cut so that we can see that pulmonary semilinear valve. And on the exam, if we ask this one, it will be on this heart that's cut all weird so that you can see this flap going into the pulmonary trunk on the front of the heart. So there's your pulmonary semilinear valve, that little flap. From there, we're going to go out to the lungs and then come back. Go in through the left atrium, left ventricle, and out through the aorta to the rest of the body. This flap right here, that's the aortic semilinear valve. We know that because it's on coming out of the left ventricle. So there's the aortic semilinear valve. That about covers it. Only other thing I can think to ask would be on the heart model. This tiny ligament right here, that is the ligamentum anteriosum. So ligamentum anteriosum. And while I'm looking at this, pulmonary trunk, pulmonary arteries go to the lungs, pulmonary veins come back to the heart. Superior vena cava, inferior vena cava. Other than that, you should see everything else on the real heart. All right, guys, good luck.